Hello, friends. So, my name is Ashish Goel. I'm a professor of medicine at the Ambedkar Institute of Medical Sciences, or AIMS at Mohali for short. In today's session, we will be talking about the ethical framework for health research. And in this short session, we will talk about the history of medical research ethics. We will talk about the principles of biomedical ethics. We will talk about the informed consent process of review of research proposals, and we will finally conclude. So, to talk about the history of research ethics, there are just three things that you should remember. One is the Nuremberg Code, which was developed after the World War II experiments among the Nazis in the Nazi camps. It was the first time that a risk benefit analysis was proposed in cases of health research. The second important event to happen in the history of research ethics was the Declaration of Helsinki, and this was the first time when they talked about autonomy and the process of informed consent. The third and the key important event in the history of research ethics was the Belmont Report, which talked about the various principles of research ethics. So if you remember those three events, the Nuremberg Code, Declaration of Helsinki, and Belmont Report, you are pretty well covered for this course. With regards to the principles of ethics, this is something that you cannot afford to forget. There are four principles of research ethics. One is autonomy, beneficence, non-maleficence, and equitable or distributive justice. So not very difficult. Autonomy means that the patient or the individual or the research participant has the right to decide what they want to choose for themselves. Beneficence, there should be a benefit arising out of the treatment or of the research study that you are conducting. Non-maleficence, obviously there should be no harm as a part of your research or treatment. And obviously equitable justice or distributive justice, that means whatever research limitations or whatever commodities, whatever is available with the research team, which will be equitably distributed among the participants. Or if a health facility has got some facilities, then these will be distributed equitably between the different patients which seek healthcare at this facility. We talk about the informed consent process. So the informed consent process is an integral part of any health research. It upholds the principle of autonomy at the top. That means the patient or the research participant is the foremost. He's the one who has the right to decide what to do, whether to participate, whether not to participate, whether to withdraw or not to withdraw. It's all in the hands of the participant. We need to talk a little bit more about the various elements of an informed consent. So an informed consent is a process. It is not a document. So it should be done in letter and spirit. A research consent or an informed consent form should include the fact that it is a research. It should describe the research. It has these 8 points. First, that it is a research and what is the description of the research. Second, it should introduce what risks are there in participating in this research. What are the benefits that the person gets? Are there any alternatives to treatment or therapy which is being offered in this research? What is the statement on confidentiality? How the data of the individual, how the disease condition of the individual will be kept confidential? What compensation is being offered? So even if no compensation is being offered, such a statement should exist in the informed consent form that no consent is being offered. Are the contact details of the researchers indicated in the consent document? And whether there is a statement on voluntariness, that the person is voluntarily participating in this research and has the option of withdrawing from the research when needed. There are certain special situations that we should consider in the informed consent process. When we are consenting children, there is assent. That means the child should assent and the parental consent is taken depending upon the age of the child. There are situations when consent from an individual may not be possible for different reasons, whether the person is not conscious, not comatose, not capable, not possible to understand the process. Then there is a surrogate consent, or somebody else who is the nearest of kin may give consent. And there are other situations when consent is not desirable, when there are deceptive studies being planned or something of that nature. There are certain situations when consent is not needed, when you are doing research only on stored samples from the past, or it's a secondary data analysis where there is no identification of the person concerned. Then obviously there are situations when consent is not needed, which you need to keep in mind. Finally, we talk about the review process. Now, there are two different kinds of review, a scientific review and an ethical review. In the scientific review, obviously, the committee or the board will decide whether the study is scientifically justified and if the methodology of the study is valid and it's the correct methodology and appropriate. However, an ethical review looks to see whether the researchers are competent to do this study. What is the risk benefit analysis? Is the risk too high? Is the benefit too low? Is the study actually even needed in the community? Is the benefit good enough? Are the participants voluntarily participating, and do they have the ability to withdraw from the study if they don't want to participate? If there is any harm happening to the participants, obviously, if there is any harm coming to the participants, then definitely they will not be permitting this kind of a study. And if there is a care support available to the participants, if somebody is diagnosed of a problem which they did not know of earlier, would there be some kind of a support offered to those participants? So all that comes under the ethical purview of the research. And finally, to conclude this session, I would just summarize by saying that we spoke about the history of medical research ethics. We spoke of the principles of ethics, in which we talked about autonomy, beneficence, non-maleficence, and distributive justice. We talked about an informed consent process, which upholds the autonomy of participants and is a very important portion of all ethical review elements. And then we spoke about the process of scientific and ethical review. I hope you found this session useful, and thanks for stopping by.